Hi, Dr. Osborne here with Web Wellness University. In today's episode, I want to talk a little bit about high blood pressure, but primarily high blood pressure medications. As many of you know, I'm one of the world's leading authorities on how drugs interact with vitamins and minerals in our bodies. And so one of the most commonly prescribed drugs are high blood pressure medications. Medications designed to reduce blood pressure. Again, the goal of reducing blood pressure is ultimately to reduce the risk of heart disease. So the problem with this concept of using drugs to lower blood pressure instead of dietary factors and lifestyle factors is that there are a lot of nutritional interrelationships with blood pressure medication and vitamins and minerals. So one of the things that happens with high blood pressure medications is we induce deficiencies of certain nutrients. So for example, I'm going to write some of these nutrients down and then we'll go back through and we'll explain why they're important in the risk of developing heart disease. Okay, so one of the things that happens when we give high blood pressure medications is a number of them actually inhibit a vitamin called vitamin B1, otherwise known as thiamine. Now, what's interesting, and the problem with this is this doesn't happen right away. So what happens is you're on a blood pressure medication for 6 to 12 months. You don't really feel any different, but 6 to 12 months later you start to feel some changes and you don't really correlate those changes as being part of a side effect of the drug itself because you've been on the drug for such a long period of time. But for these deficiencies to take effect, it generally takes a pretty long time. We're talking about, on average, about 6 months to develop a deficiency as a result of a high blood pressure medication. So in the case of vitamin B1, one of the things that happens with vitamin B1 deficiency is we develop a weak heart, okay? So, and actually what it leads to, there's a name for a disease of B1 deficiency. It's actually called beriberi. And beriberi is a disease that affects the heart. It affects the muscle of the heart, makes the heart muscle a lot weaker, and induces something called congestive heart failure. As a matter of fact, there was a recent hospital study done where they took a number of patients who had been on long-term diuretics, long-term high blood pressure medications, and they found that these patients were developing congestive heart failure. And when they went back and looked at a number of different chemical parameters, one of the conclusions they drew was that a lot of these patients, the reason they developed congestive heart failure was because the diuretic that they were taking actually caused a vitamin B1 deficiency. So when they supplemented these patients with vitamin B1, guess what happened? Their heart failure improved. In other words, their congestion of their heart actually improved. And so that's one of the things that you should be aware of if you're on a blood pressure medication. That's one of the things that your doctor should be testing you for if you're on a blood pressure medication. It's one of the things he should test you for before he even puts you on a blood pressure medication. You should be able to test your levels of vitamin B1 and make sure that you're not at risk before even introducing the medication. Additionally, we know that the high blood pressure medications can cause magnesium, potassium, and calcium deficiencies. Now, let's talk a little bit about magnesium. Magnesium is very important because it works as a natural blood thinner. So a lot of doctors will prescribe Bayer aspirin or some other form of aspirin to help reduce the risk of heart disease because aspirin is a blood thinner. Well, here we are. Remember, we're trying to reduce the risk of heart disease. We're taking a medicine that causes a mineral deficiency. This mineral deficiency actually causes your blood to get thicker, thus increasing your risk for heart disease. But that's not all. Magnesium, potassium, and calcium are electrolytes. And there was a major group of studies that was done about 10 years ago, and these studies were called the DASH studies. DASH is an acronym. It stands for Dietary Approaches to Stop Hypertension. And so what they found is that when they put patients that had high blood pressure on diets that were rich in potassium, calcium, and magnesium, guess what happened? Their blood pressure went down. So we know that these three minerals being deficient can actually cause elevations in blood pressure because they influence the contractility of the blood vessels. In essence, remember that blood vessels are these tubes, okay, and blood's pumped through these tubes, and as blood's being pumped through, there's a muscle that surrounds this layer of tube, and that muscle contracts. And as that muscle contracts, that's how blood pressure works. It pushes the blood through the body. Well, what happens when you're deficient in these nutrients is those muscles, instead of contracting normally, actually go into spasm. And they become more, as the more in spasm they become, the more dense the vessel becomes and the less resilient it becomes. So we get a higher rate of blood pressure. So when we're taking a medication to lower blood pressure and the medication ends up inducing high blood pressure, but just through a different mechanism, we're actually chasing our tail in terms of medical treatment. And this is one of the reasons why a lot of patients will start out with a blood pressure medication, and then over time it quits working and they have to go back to their doctor to get a different kind of blood pressure medication that works through a different mechanism. And so they end up chasing different medications and combining different medications to control the same problem. And many of the times the reason why is because those medications are inducing deficiencies that actually lead to high blood pressure. It doesn't make a whole lot of sense. And you probably ask yourself this question: why doesn't my doctor know about these things? And why is he not at least investigating these issues while I'm on these medications? That's a really good question. So what I encourage you to do is take this information into your doctor and talk about these concerns, and that way you can feel safer, you can feel more comfortable, but you can address these issues before they become a major problem. Now, there's one other nutrient that we know is depleted by blood pressure medications, and that's CoQ10. Now, in our last episode, we talked in depth about CoQ10, and we said that CoQ10 deficiency caused high blood pressure. We said CoQ10 deficiency caused congestive heart failure, and we said that CoQ10 deficiency caused muscle weakness, okay, which led to inactivity, which led to what? When we're sedentary, when we don't exercise, what happens to our blood pressure? It goes up. Remember, two of the biggest things and the best things that you can do to maintain good blood pressure: one, exercise adequately, and by adequately I mean in some cases aggressively depending on the person, but also maintaining a diet that's conducive to your health. And that's different for different people. Some people are allergic to certain types of foods. Some people are allergic to other certain types of foods. Some people can tolerate certain things better than others. So again, we've got specific individual needs that come into play here. So again, talking with your doctor is the best way to determine what your unique dietary needs are. And my advice is look for a functional medicine doctor, somebody who can address your needs as opposed to just masking your symptoms with a drug that doesn't actually provide a viable solution to your problem, but it only covers up the symptoms. So again, high blood pressure medications, the whole goal is to reduce the risk of heart disease. But what ends up happening over chronic use is we end up creating deficiencies of certain vitamins and minerals and nutrients, and the outcome of that is increased high blood pressure. So doesn't make a whole lot of sense. Take this information to your doctor. Make sure that you address this with your doctor so that you don't end up on a bunch of medications that end up making you sicker than when you originally started. I'm Dr. Osborne. I'm wishing you good health. Have a great day.